The South African Medical Association has called for calm after the first case of the Covid-19 subvariant, Eris, was logged in Gauteng. The Omicron variant has seen a wave of new cases around the world, though.
We need not be worried and we do not need to panic, but we need to be aware that there is a subvariant of Omicron that is circulating around, dominant in the US, but in many other countries as well. But, you know, obviously the usual way of avoiding infections is all those public health measures that we always preach, and I think they're still relevant.
All right, let's unpack the story further this morning. We're joined by virologist and researcher, Professor Tulio de Oliveira. It's great to talk to you. As always, thanks very much indeed for your time, Prof. And you as well, you've stressed the need for a sense of calm. You've said there's no need to panic over this new subvariant. But given, Prof, where we've all come from, you know, for those of us who have lost a number of loved ones, the news of this kind of subvariant, there would be, you know, a level of panic that would be understandable.
Okay, yeah. Good morning, and good morning to all your viewers. So one do not need to panic. It's absolute no need to panic. Yeah, South Africa has been for the past year and a half in kind of with very low waves of infections, which did not translate in high hospitalization and deaths. Yeah. So this lineage it's just a lineage of Omicron. Mm-hmm. It's still Omicron. Yeah. It's not very different from the one that has been circulated in South Africa for the last 6 months. Yeah. And maybe a little bit more transmissible. Yeah. But we do not see any signs of increased infections, hospitalization, or deaths. Yeah. And for the ones that are concerned and that are worried, especially if they are adult over 65 years old, or if they have comorbidities or immune suppression, it's always wise to get a booster vaccination, which is widely available in the public health facilities, especially if your last vaccination or last infection was over a year ago. But so far, South Africa has a very high level of population immunity. We have a very robust system of genomic surveillance, yeah, and that's what we do, is to continuously do the analysis of both genomes, but all the data in the country. And so far, what I like to say, we are alert to the new variant. We have strong systems, but at the moment we are not concerned.
Yeah, that is the most important point, isn't it, Prof? That our genomic surveillance teams are constantly keeping an eye out, and the point of it is that there is no evidence, as you say, of severe disease, which is the important takeaway.
Yes, of course. Yeah, that's really important. We also don't see our hospitals receiving large number of patients with COVID or going to the ICU. We really pass to the next phase of the pandemic. Yeah, that's not that more extreme deadly phase. Of course, many of us will remember that. Yeah, I have lost many friends and colleagues. Yeah, so that is still alive in our heads. Yeah, and the suggestion at the moment is really about common sense. Yeah, if you have a cold or a flu or the same symptoms that as COVID, maybe stay at home. Yeah, for a couple of days, hydrate, so make sure that you don't spread further. Yeah, the ones that are coughing or sneezing may be quite wise to use a mask, not to infect other ones. Yeah. And the ones that are really concerned to present for a booster vaccination. But otherwise, we can continue going with our normal life. Yeah. And one thing that South Africa have well is this network of genomic surveillance that also involve hospitals, laboratories, with very clear communication to the Department of Health. We still send them reports every week. And if anything of more concern arrive, yeah, we will be communicating that with the Department of Health, as we did many times during the pandemic.
Prof, can I ask you this? Are you concerned that, you know, we might have more cases of Eris in circulation because people are actually not getting tested? So I may well present with a whole range of symptoms, which I assume could just be a bad case of the flu. But we're at the stage of the pandemic now where people are actually not getting tested.
Okay, First, we are just finished what we call our flu season. And this year was quite a bad one. The cases were much higher than the last couple of years. And that's not surprise. We had lower flu seasons. Normally that's associated with the winter. At the moment in the disease severity and symptoms, it's quite difficult to distinguish between the flu and COVID, which is a good sign for the COVID and the current level of the pandemic. When we were like 3 years ago, was a very clear, distinct number of symptoms and hospitals getting full. Why that? This is because South Africa has a high level of population immunity from previous infection and vaccination. And anyone that's concerned both at flu or COVID, it may be wiser to get an extra dose of the vaccine, which also the flu vaccine is available.
Speaking of the vaccine, Prof, I just saw a report that the U.S. is rolling out a new vaccine in response to rising infections in that country, but even predictions in the U.S. are that it won't be well received, that people are not lining up to get vaccinated. Are we concerned about the level of vaccination in our country as well at this stage of the pandemic?
So not really. South Africa has a very high population immunity from both vaccinated and from previous infection. Of course, that one can always get concerned for a family member with advanced age or very strong comorbidity, and that's at the moment what we should focus. If we have a family member with very advanced age, comorbidity, or immune suppressed, may be wise to then to get an extra booster of vaccination, but otherwise for the general population, we don't see an increase of severity. On the opposite, we see that in the last year and a half, we have very few deaths and very severe cases of COVID in normal health individuals.
Professor Tulio de Oliveira, let me thank you for your time this morning, Prof, giving us some important context there to the first case of that COVID-19 subvariant Eris being detected in Gauteng.